Hi, I am Dr. Vinayakhram, Senior Consultant Surgeon, Department of General Laparoscopic and Vascular Surgery at Baby Memorial Hospital, Calicut. The topic today I am going to talk about is varicose veins. First, let me give you a very brief common man's perspective of what is varicose veins. So, what is varicose veins? When there are dilated veins seen on both the lower limbs, that's both our legs. So, people think that it's quite normal because in most of the conditions it is painless. It is completely asymptomatic, so people do not worry about it until the further complications of varicose vein starts to manifest. So, how does it start? So, varicose vein, first of all, it is described as an occupational disease. So, what do you call by an occupational disease? Occupational disease is something which is related to the kind of work we do. So this disease is quite common in people who are standing for very long hours, say for example a police personnel or a person who is in a teaching profession like a professor or a teacher or somebody like that, or who is a chef who used to stand about 12 to 14 hours a day. So this disease is quite common in these kind of people who used to stand and work for a very long time. Also in women, the initial stages of varicose vein usually happens during pregnancy. When there is, especially when there are twin pregnancies, when there is a lot of back pressure from the uterus onto the veins, that is veins that brings blood from the foot to the heart, there is an initial stages of varicose veins. But in most of this condition, this varicose vein gets reverted back to normal once the delivery happens. Only in a very few percentage of women, this progresses into a full-fledged disease. So what are the symptoms the patient will have? So this is very important because most of the people try to attribute the symptoms to some other disease and they end up in different kinds of specialties not knowing why the symptoms are happening. So first and foremost, the patient starts noticing very prominent dilated veins, especially below the knees. Why below the knees? Because though the disease starts at the beginning of your lower limb, the main valve, that is, we call it at a saphenofemoral junction, which is at the groin at level, is incompetent. It is not visible outside because of the thick muscle present in the thighs. Whereas below the knee, the muscle mass is relatively very less compared to the muscle in the thigh. Hence, the veins are more prominent below the knees. That is the first sign the patient will have. Number two, patients will start developing swelling around the ankle. In clinical terms, we call it as edema. That is especially when they are traveling for a very long time or when they are standing for a very long time, they suddenly notice a swelling around the ankle. More so, this swelling is more prominent during the evening hours when the person stands the whole day and when he goes back home and he notices a swelling around the ankle. That's when you suspect a possibility of a varicosity in that lower limb. The third symptom is itching. There will be a lot of itching around the ankle because of this stagnated, deoxygenated blood around the ankle. This again is one of the prominent symptoms of varicose vein. When the disease progresses, the patient starts noticing that skin around the ankle becomes very dark. We call it as hyperpigmentation. That is because of the deposit of iron on the skin from this deoxygenated blood. So that is the next level of the disease. So when there is itching and there is darkening of the skin, the patient, by mistake, if he creates a trauma to the skin, it forms an ulcer. That's when the patient ends up in a hospital to show or to find out why this has happened. So when there is an itching around the ankle, he tries to he might have sharp pains, he might injure his own skin. It starts as a very small wound and then it spreads around the ankle into a big ulcer. We call that as a varicose ulcer. So these are the very common symptoms or signs of varicose vein which people will come across. Okay, so what can be done for this varicose vein? One thing has to be very clear here, that medical management of varicose vein is very ineffective because most of the medical managements are targeted towards one single symptom. Say for example, if there is swelling, you can take a couple of medications, it brings down the swelling, but you are not correcting the cause, that is the reason for the swelling, but you are just reducing swelling. Similarly, when there is itching, you can take a couple of medications and stop the itching temporarily, but you are again not correcting the cause for that itching. So the real treatment for varicose vein is only the surgical management, but before that, what can the patient do? The first thing, he has to consult a surgeon and find out what is the state of his varicosity. So to understand the state of his varicosity, he has to undergo a scan called as a venous Doppler scan. The venous Doppler scan clearly shows us what is the diameter of the vein in the lower limb. That is number one. Number two, what are the status of the valves? The main valve, I said earlier, it lies in the groin. That is a saphenofemoral junction. That is a main valve which causes the backflow of this blood into the limb which is supposed to go to the heart is coming back to the limb. So there, what will be the status of the saphenofemoral valve? Number 3, there's one more major valve called as a saphenopopliteal valve. So these are the two main valves which control the blood flow from the lower limb to the heart. When there is a problem with these valves, there is a backflow of blood from upper body towards the lower limb. That's when the disease starts. So when the patient undergoes a venous Doppler, we get a clear picture of what are the status of the major valves, what are the status of these perforators, and what is the diameter of the vein. All this helps in planning the treatment for the patients. Now coming to the treatment options, we have two kinds of treatment. In the earlier days, we used to do the open surgery. So anyways, this vein is not functional. So the best treatment available is to get rid of this vein. How can you get rid of it? There are two ways of doing it. One is your open surgery. When you do an open surgery, we used to cut the limb, take out the vein and completely remove it surgically, which is an obsolete procedure. We don't do it anymore nowadays. What we do right now is the ablation of the veins. Ablation of the veins in the form of either a laser or a radiofrequency ablator. The principle of the procedure, as I mentioned, the radiofrequency as well as the laser, the principle is the same, but only thing is energy source what we use for the treatment differs. In radiofrequency, we use a microwave, whereas in laser, we use the laser energy to ablate the vein. So what we do here is, we put in I wouldn't even call it as a keyhole, it is actually a pinhole. We put it in the limb and we try to pass this catheter, either a radiofrequency catheter or a laser catheter, into the veins, and we completely ablate the veins using this energy source. Now, what is the advantages of this procedure? Number one, it is a daycare procedure. So when I mean daycare, the patient can come in the morning, walk into the hospital in the morning, get the procedure done and walk back the very same day evening and start walking without the need for any rest or hospitalization. That is a major difference between open surgery and the endovenous laser surgery, because in an open surgery the patient will be bedridden for about 3 to 4 days in the hospital, and there will be open wound, there will be stitches, and he has to undergo a whole lot of these things to get the disease cured. Whereas in laser surgery, it is completely minimally invasive and patient can resume his work as early as possible. Even the very next day he can get back to work, and there will not be any scar or marks on the limb. So these are the advantages of the laser surgery what we advise. Now why the patient should be aware of the symptoms is that earlier it is easier to, when the disease is in a very earlier stage, it is very easier to do a laser or a radiofrequency ablation. But if the disease is advanced, say about 15-20 years old disease, I'm not saying it cannot be done, but it will be challenging to do, and sometimes it might be impossible to do, because it's a very simple practical point. You can understand, the laser cable is a very straight cable, whereas so when you pass a laser cable, the vein has to be straight so that it can pass into the vein smoothly. The advanced stages of the disease, the vein starts coiling like you can imagine a routine landline phone call, it coils like that. So it is impossible to pass the laser cable into that coil. So we advise for an open surgery. That's why it's very important for the patient to realize the symptoms of varicose vein at the very early stages of the disease, so that they can be treated in the most efficient and the most advanced way of treatment. Thank you.
Issued in public interest by Baby Memorial Hospital, Calicut.